First procedure is to identify the patient, and then after that is to explain the procedure to the patient. So, good evening, ma'am. So, I am Tristan si Bangug, your student nurse from the Medical Colleges of Northern Philippines. So, I'm going to assess your thorax and lungs. So, if you have any questions, so feel free to ask me. So, but before that, so may I know your name?
Ayesha Gina,
Your date of birth?
April 7.
Okay, so after that is you need to perform hand hygiene. The next is to assist the patient to change their clothes to examination gown. So, ma'am, can you change your clothes to examination gown? So after assisting the patient to change their clothes to examination gown, so you need to check for the breathing of the patient if it is symmetrical. So ask the patient to have a deep breath. So ma'am, can you please have a deep breath, ma'am? Okay. So after that is assist the patient to a sitting position. So as you can see, the patient is already at the sitting position. So ma'am, can you move over here? So next thing to do is to inspect the posterior thorax. So you need to see for skin discoloration, so muscle development, or you need to check for the muscle of the spine and also for the shoulder blades. So now I'm going to inspect. So after inspecting the posterior, so you need to palpate or check for the anterior posterior and lateral diameter of the thorax. So ask the patient to raise their hand. So ma'am, can you raise your hand, ma'am? Okay. So the ratio must be 1:2. So after that is you need to palpate the spine in the posterior thorax. So the first thing to do is to palpate for the temperature. So you need to use your dorsal surface of your hand. Okay. So after palpating the temperature, so you need to palpate palpate the posterior using the palmar surface of your hand. So you need to check if there is tenderness or masses or muscle development. So after palpation, so you need to assess the tactile fremitus or palpate for the tactile fremitus. So before checking or assessing the tactile fremitus, so you need to ask the patient to have a deep breath. So ma'am, can you please have a deep breath, ma'am? Okay, so you need to place your hands on the posterior of the patient. So using the zigzag pattern, so you need to put the ball of your palm. So you need to palpate it while the patient says 99. So ma'am, can you say 99?
99.
Again?
99.
Okay. Again?
99.
Again?
99.
Again?
99.
Again?
99.
Okay.
99. 99. 99.
Okay. After that is you need to assess the lung expansion of the patient. So you need to put your hands at the back of the patient, at the thoracic 9 or thoracic 10. So ask the patient to have a deep breath. So ma'am, can you have a deep breath po? Okay. So the separation of your thumb must be 3 to 5 centimeter. So after that is you need to percuss the posterior thorax. So using the zigzag pattern, so percuss it. Okay, I've done percussing the thorax of the patients, done percussing the posterior thorax. So after that is I'm going to auscultate it. But before that, so I'm going to ask the patient to use their mouth to breathe deeply. So ma'am, can you use your mouth in breathing while I'm auscultating? So ma'am, can you have a deep breath po? Okay. Again. 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 Okay. Again. Okay. Okay, so there is no abnormal breath sound. So I've done examining the posterior thorax of the patient. So now is I'm going to examine also the anterior thorax of the patient. So I'm going to ask the patient to rearrange the gown in order for the chest to be exposed. So ma'am, can you rearrange your gown? Okay, so I've done asking the patient to rearrange her gown. So I'm going now to inspect the anterior thorax. So I need to check for the skin if there is any discoloration. So after that is I need also to check for the muscle if there is a muscle development. Okay. So next is I'm going to check for the symmetry. So if it is symmetrical, so I'm going to note that. Then after that is I need to check for the lung expansion of the patient, or if the patient is using any accessory muscle in breathing. So ma'am, can you take a deep breath for me? Okay. So after inspecting, so I'm going to palpate for the tactile fremitus. So after checking for or palpating the tactile fremitus, I'm going to percussing over the anterior thorax. So you need to inspect for the axillae and the chest of the patient. So ma'am, can you stand for me? So ask the patient to put their hands at their side. So ma'am, can you do this? And then put their hands on their hips. So ma'am. And then after that is put their hands at the top of their head. So ma'am. Okay, thank you very much. Okay, you may sit. So after inspecting, so you need to palpate. So if ask the patient to or assist the patient in supine position. So put a towel or pillow at the back of the patient in order for the chest to be exposed. So after palpating the axillae and the chest of the patient, so you need to help the patient to undress or change their examination gown to their comfortable clothes. So ma'am, may I ask you to please change your alis ka na. Okay, after that is you need to perform hand hygiene. Okay, so thank you very much ma'am. So I've done assessing your thorax and lungs. So thank you very much for your cooperation. So again, good evening and goodbye.
And perform hand hygiene.